Hi, I'm Dr. Wix-Harris, and I'm a cosmetic physician here at Reflection Center in Martinsville. And today I'm going to go do under eye filler on my daughter, Julia. Jules just turned 21 yesterday, and for her birthday, she wanted me to do something to fix her under eyes. When you look at Julia's eyes, the first thing that I notice is that she has some hyperpigmentation of the skin, which is genetic. That part I cannot fix. Jules, close your eyes for a second. You can see it on the upper eyelid too, So that's not hollowing or shadowing. That's just the skin is darker there. Okay, open your eyes. Now, the next thing that you can see is she has this big groove right here. And you can see if I can kind of puff that out a little bit, which is what we can do with filler, it looks a lot better. It looks a lot lighter, and so that's the part that we're going to do with filler. Then she also has a little bit of a, bulge up there. And I'm going to put a tiny bit of Botox in there and kind of see if we can get that to be a little bit less noticeable. Okay, the other thing Julia has is that she is a clencher. So she has very big masseters. Jules, clench for me for a second. When you feel this, you can just see it's like rock hard. You can bounce a ball on that. Okay. So, but what that does, do both sides, Jules. Clench. And just relax. Yes, and what you can see is that, it makes her cheeks, her face much more square and wider, but it also gives her a lot of headaches and pain in her teeth and jawline. So it's for two reasons. Cosmetically, it'll help slim her face, but most importantly, it'll spare her teeth and, relieve some of the jaw pain that she has. What we use for that is Botox. It will relax that muscle. I usually make 5 injections in that. And Julia, we already did it once a couple of months ago, because unfortunately it only lasts about 3 to 4 months. And Jules, tell me, how was it to do the Botox? Did it hurt?
No,
was
it
bad?
didn't hurt at all.
Okay, and how do you feel it helped?
It definitely made them smaller, and I didn't bite as hard when I sleep, and I definitely had a lot less headaches.
Okay. First thing we're going to do is we're going to clean the area, because it's very important to prevent infection. So we clean with 2 different types of cleaning. One is a little bit more soapy. One that is a little bit more, smells like Clorox a little bit. Can you smell it? Okay, so we're going to use a little, what we call a guide, to just make a little entry point on her cheek. Because for the under eyes, I like to use a cannula, which has a blunt tip, and it doesn't penetrate the skin. So you have to make an opening first. Okay, here we go.
Julia said that this part felt weird, and a lot of times people will feel that way because you can feel that there's something under your skin, and it's moving around. It doesn't really poke you or is painful. It just kind of feels strange to have something moving around under the skin. And there's also a little bit of a numbing agent in it, so you're starting to feel numb in that area, and the blink can become a little bit heavy, and this will continue to feel kind of weird and numb for about an hour and a half afterwards. It's not the same kind of level of numbness that you have when you get your cavity filled, but it does feel kind of strange. It's not really painful though. For my daughter's under eyes, HA stands for hyaluronic acid. There are really just a few fillers that I like to use for the under eye area because the skin is so thin. You can't really use a filler like you would use normally in the lips or the chin, or something that attracts a lot of water, because you'll end up with a lot of swelling. We do have a very large range of fillers available in our office, and it really helps because just because you can use a certain type of filler under the eye doesn't mean that it's right for every patient. I will, change depending on what the skin quality of somebody looks like to decide what type of filler I will use in the under eye. My daughter's under eye hollowing is not caused by aging. I mean, she's 21 years old. It's just genetic. It's how her under eyes have looked for a while now. And she was really bothered by it, and having it filled with a temporary filler will help her look better when she puts on her makeup. And that makes her just feel better. And women her age are doing a lot of these little small tweaks with filler just to, you know, make them feel good. It's a good choice, especially for a patient that's young, because this filler does dissolve over time. Meaning that in a couple of years, when she's aging, she may need a different type of filler, or it may need to be in a different spot for her to work.
Under eyes can sometimes swell a little bit, so I would, you need to sleep kind of elevated for the next 2 days, like with 2 pillows instead of flat on your back, you know, and ideally sleep on your back instead of on your side, because that will help reduce the swelling. They tend to swell a little bit more in the morning, so you may want to put a little bit of ice on it in the morning if you feel like they're swollen. I mean, It doesn't happen in everybody, and you're young, you have nice young skin, so I don't expect a lot of swelling in your case, okay? You're going to be kind of weird, numb for about 2 hours. That's the numbing medicine in the filler that will wear off on its own. It can make you feel like you blink really heavy, but it does nothing with your vision. It doesn't. You can drive. You know, you don't have to worry about that. And it will get better and better in the next 2 weeks, because in the beginning it still feels a little lumpy and clumpy, but over time it kind of smooths out, and then over time you can barely feel that it's there. And it usually lasts about 1 year to 2 years. Under eyes can last a long time, so we'll see how fast your body breaks it down.
Okay.